If you are getting a hair transplant, these 5 mistakes will either make or break your results. If you've had or are considering a hair restoration surgery, there's something most patients are not told. Your results don't just depend on what happens in surgery. A big part of it actually depends on what's going to happen after. Now that's what I want to talk to you about today. I've seen patients follow every instruction perfectly and achieve excellent natural looking results. And I've seen others unintentionally compromise their results by doing things that seem harmless at the time, but have long-term consequences. So here are the 5 mistakes patients most commonly make after hair restoration surgery from a doctor's perspective and how to avoid them. Mistake number 1 is trying to rush recovery. Patients often feel very good and quickly after surgery, and they assume that means they can return to intense exercise or physical strain early. The grafts are particularly delicate during the first couple of weeks. Even small amounts of pressure, sweating, or friction can affect healing and dislodge the hair follicle to an unnatural angle or even cause it to pop out. Mistake number 2 is touching or picking at scabs too early. Itching and scabbing are entirely normal, but with interfering them can dislodge grafts because they haven't settled in yet. That's why we provide very particular washing instructions, and it's important for you to follow these diligently. If you're watching this because you're recovering right now or preparing for surgery, here's the part most patients want to know: what actually affects the final result? The next 3 mistakes have much more to do with long-term planning than with short-term healing. Mistake number 3 is stopping hair loss medications too soon or not using it at all. Transplanted hair is permanent, but the native hair around it may continue to thin due to the underlying condition. Medications help stabilize hair loss, so the transplant blends naturally over time. Without it, some patients may end up needing additional surgery or having patchy results. Mistake number 4 is expecting the final result too early. Now, growth typically starts around month 3 to 4, but meaningful change usually happens between month 6 and 12. Your final results often happen closer to 12 to 18 months. Comparing early results to someone's final outcome can create unnecessary worry and unrealistic expectations. And finally, mistake number 5, planning only for right now and not for the long term. A hair transplant should be designed with the future in mind. Your hairline, density, donor use should match how your hair might age over the next 10, 20, and even 30 years. That's something we take seriously, and it's a key part of how we design surgery. Thank you very much for watching, and if you found this helpful, save it, share it, or reach out if you'd like to discuss your own plan. Thank you very much.